Hello, Utah. We're going to, what I want to do here is run some numbers by you real quick in a graphic and audio format so that you can just look to see in Utah what the numbers of people who will be affected by the current version of what the Senate and House have been voting on have been trying to push through. So let's talk about the numbers first. The numbers you're looking at are state and congressional district breakout estimates by the Center for American Progress of how many people the nonpartisan CBO, Congressional Budget Office, expects would lose health care coverage by 2026 if the Republican Trump care law were to become law in Utah. The numbers I'm going to show you are just in Utah. Okay, here, let me move this out of the way so we don't have that out here anymore. Just real quick, 19 states did not adopt the Medicare expansion, and that includes Utah. So your numbers are different and are calculated differently. Let's come down here. 19 states have not expanded Medicaid. For these states, it's important people understand the CBO is comparing what they expect coverage in 2026 under current law is. They're going to weigh that against what they expect would be under the BCRA / Trump care bill. And another note to that is that the CBO is confident that if the AHCA isn't messed around with, states representing about 80% of the expansion eligible population would go ahead and expand the program by 2026. The cap analysis basically takes that figure, 80%, and assigns it to all 19 states. There's a little footnote at the bottom of the numbers chart I'm about to show you. So here come the actual numbers for Utah. And these are projected numbers. Here's the note that was referred to before. The CBO, it pretty much says what I just said. You can go ahead and read that. And so the numbers, Utah. Here, by the way, here are your representatives' names, and I'll show you how to find their contact information in just a few seconds. Let's hit the numbers real quickly. Non-elderly Medicaid people in Utah who will lose their coverage by 2026. That's less than 10 years away, and that's how these plans are figured out. There are about 9,000 adults, 26,000 children, 3,900 disabled, another almost 80,000 that are covered under the Medicaid expansion of the ACA, and that comes to a subtotal of non-elderly of almost 120,000 Utah folks who are going to lose your coverage. That's Medicaid non-elderly. Medicaid elderly is over here, and in Utah, they're gauging about almost 4,000 elderly will lose their Medicaid coverage. And that is broken out from the number of non-seniors, which is about 186,000 for Utah. Now, what can you do? This is kind of cool. Here. First thing is the Trump Care Toolkit. If your senator is one of those who is flexible and is really flexible and not committing, you would be listed here. They're not, so you're going to have to take some extra strong steps to make sure that your representatives and senator know how you feel about losing this much health insurance coverage. Basically your health security is being pulled out from under your feet. Okay, a couple more tools. The House of Representatives is at house.gov, and if you want to find your representatives, they make it easy here. You hit representatives, and there's a list directory by state. Now, Utah would be under the U, and here you go. And then it breaks it down by district. So here are your state representatives, and you can check on any one of those. Oh, by the way, their phone number is listed right here, and the committees they're on. If you click on one of these, it'll take you to their page that kind of talks all about how wonderful they are, and you can leave information there, feedback there for how you feel about insurance, what's going on with the insurance anyways. Remember, the House folks are the ones that started this thing, and now the Senate is moving in on it. In the next week or so, plan to vote to cram this thing down 50 people, 49 people's throats because McConnell's all bought in, lock, stock, and barrel, as are many others. Your senators is senate.gov. Again, find your senators. You can look by state, and again, Utah's right here, and it'll show your senators and how to reach them, their contact information, and phone numbers, etc. I want to give a shout out to Charles Gava at ACAsignups.net. This site deeply dives into the numbers and the factors behind insurance that cause the rates to change. I think that's about it. You guys, what do you do next? Make some calls. Call your senators, so the local office and the DC office, and do the same for your representatives. Call their local office and their DC offices and let them know how you feel about this. If you think it's great, let them know. If you're concerned and think it should be something else, please extra let them know. Twitter, Facebook, there's all kinds of ways to contact these folks. Calling them on the telephone with those numbers that you saw are the way to do it quickly and efficiently. Have a great day, and go for it, Utah.